Welcome to the Black Unconscious.
A mental health podcast about living, coping, and thriving while Black.
I'm Raquel Martin, a PhD candidate in medical and clinical psychology.
And I'm Dr. Justin Hopkins, a licensed clinical psychologist.
This podcast is not meant to be a substitute for a therapeutic relationship with a licensed therapist.
Thank you for tuning in, and we hope you enjoy the show.
Welcome to episode 2 of the Black Unconscious, a mental health podcast about coping, living, and thriving while Black. We are your hosts, Raquel Martin
and Dr. Justin Hopkins.
Thank you for tuning in. So today's episode is about stigma. So mental health stigma, to be really specific, like a bunch of topics, like where does stigma come from regarding mental health, stigma about a bunch of different disorders, about taking medication, and like what to do to combat stigma.
And furthermore, we'll talk a little bit about what is mental health service, the types of mental health service there are, the types of mental health professionals there are. In this episode, we'll do what we can to try to just demystify mental health service and address and break down some of the things that contribute to stigma and the lack of utilization of mental health resources.
Yeah, definitely. Because I think one of the things that helps keep stigma alive is the lack of education, like just not knowing about stuff. So just like the historical context of stigma, when I was thinking about this episode, the first thing of stigma, but of mental health stigma, the first thing I wrote down was like house business stays in the house. Like when it comes to like why people, or why minorities or why Black people specifically don't go to see mental health clinicians, is that I was always told growing up, like, house business stays in the house. Thanks, Mom. But, like, it's kind of just like, you know, you don't really, you know, share your business out there with everybody.
Right. This is very, like, communalistic perspective that, you know, what happens within the family stays within the family. What happens when the community stays within the community. You don't tell other people some of the issues that you're dealing with or what you're struggling with. And sometimes, while that can instill a sense of like loyalty and like bond with some family members, it's not all bad, right? There's a sense of togetherness and cohesion that can go into that level of loyalty and being really clear about who you do or do not share things with. On the other hand, though, I think it's a very slippery slope, and we can at times, if that's something that you've grown up with, that things are supposed to be kept within the family, that sometimes things can go unacknowledged, right?
Yeah, like secret, like, so working with kids, I feel like secrets have no business in when it comes to kids. Like, it can be dangerous, right? Like, especially as someone who has worked with victims of assault and victims of trauma and stuff like that. Like, I just have always felt that secrets have no place when it comes, especially dealing with children. It's like, well, what kind of secret you have? Like, you're 8. So like, I think it can be good as like loyalty, but it can also be very dangerous with not saying things that are happening,
right.
And not knowing what's. So if you only have one perspective, like if you only have one, you only see like one aspect of it, you don't know what's not normal,
right? Like
even something as simple as I always like my cereal in the refrigerator, and my husband thinks that's insane. But like, I would have never, if we never lived together, I'd be like, why is the refrigerator, and why is the cereal on top of the refrigerator?
Right.
Like, because I'm a normal human.
Right.
Like, you know, it's just like you don't know.
Right.
So
right.
I think when it comes to like mental health and stuff like that, like that's another issue. Like I can see both sides of it, but I do think everyone has heard that quote, like, nah, house business stays in the house. I'm not about to talk to somebody about that. Yeah.
Right. And you know, normalcy, especially with things like that, they're all relative. So sometimes like that level of like secrecy and confinement, depending on like to what degree, like how bad it is. If you're someone who grew up like you don't tell anybody like anything that's going on outside of the family other than people that are within the family, then again, like you're not exposed to many other options for how you can live or for how things can be, right?
Yeah, or how to manage issues.
Or how to manage issues, or how to address issues, how to acknowledge them. So that can be challenging for someone that may end up dealing with something that other families have not dealt with or don't know how to help you with. And so if you end up in that kind of situation, there's I think for a lot of people there's a level of guilt that they feel about wanting to talk to somebody else about it, wanting to reach outside of the family, and or perhaps just like wanting to resolve whatever it is, and realizing like the family, like inside the family is not it's not sufficient, or perhaps you need a professional, perhaps you want to talk to a paraprofessional, or even a colleague or a friend. So some of those generational lessons, albeit like useful and well intentioned, I think. At times, they can have this drawback for some people of not being able to share or acknowledge the things that they're going through, or feeling too guilty about reaching out for help about some of the issues, and that certainly contributes to stigma.
Yeah, and when I say like when I think of family, I think of like not just your family of origin. I think back in the day, and for some areas, like family was just the Black community as a whole. Like we were all a family.
Right.
And
extended family was family.
Yeah, extended family was family. Like, right. You know somebody more than like 6 years, that's your cousin. Like, that's my cousin. Right, like all my aunties, that's just my mom's best friend who just happened to raise me and could like tell me, get me in line. But like also it was a protective factor because it was the only way for us to stay alive. Like us as a community, like you can't really share too much, but like we can only share with each other because talking too much or like not entrusting the wrong person, back in the day that could have resulted in your death. Like that's just what it is. So I can understand where it comes from, but I also think it comes from not seeing mental health as something that like we as Black people do. It's like a mental. I'm not about to go to a mental, like a psychologist. I'm not rich. Like that's not like, I've heard someone actually told me like, oh, you got that rich person job. Yeah. So I'm from Philly. Like, I don't know where, but it's just like, just being surprised that I work in community mental health and I work with kids that look like me. Like now, and when I was younger, they were just like, they just assumed that we didn't go to see clinicians because they wouldn't go to see clinicians. Right. Which I get because I also think there's like a fear of just people we don't know, or like the majority population. Like I think there's always there's a understandable like fear or mistrust when it comes to white people at times, especially in medical professions.
And I think absolutely. And I think there have been some researchers and authors who have talked about there's paranoia, but then there's also something called cultural paranoia, which is actually a more healthy, like functional form of paranoia. Paranoia that is rational, that is justified, and then based in like historical and to some extent like contemporary like experiences that people of certain cultural groups have that bring your guard up. And so
it makes sense, right?
That makes sense. right, absolutely. So there's this general cultural paranoia, I'll call it, which again is a healthy level of skepticism and guard, not to be confused with pathological paranoia that I think a lot of people of color actually have when considering seeking like mental health services, and they don't see people that look like them, people that they feel like they have a lot in common with to begin with, and sometimes that can breed for many people, that can breed further distrust, further discomfort, and an unwillingness to participate, even when it's quite clear that there are some concerns that need to be addressed.
Yeah, and especially, and I think it's good to highlight that you mentioned like the key word is like that's pathological. Paranoia, like that is a problem.
Right, pathological. But the paranoia that Black folks have, especially when seeing whether it be white clinicians or white physicians, a lot of that is based in actual experiences that Black folks have had generations past and some present. And there's a couple of points in history that clearly like kind of present that kind of evidence.
Yeah, there are a bunch, but the biggest ones that I always think about is like the Tuskegee study and Henrietta Lacks.
Yes,
because like when I used to try to recruit Black participants for my research study in Nashville, I got a bigger buy-in once they saw me. Like, it's like, all right, you cool. Like, you ain't gonna try to like clone me or something. But this one older lady was just like, you're not gonna get that many people out here because the Tuskegee study wasn't that long ago. Like, all know about it. So if you don't know about, like, one, there's a book called The Immortal Life of Henrietta Lacks, which is a very good book. And Justin also mentioned, like, there was a Law and Order episode. I saw the episode too,
yes,
I was like, all these episodes are real because this is a real thing. But,
right. So share about the Henrietta Lacks
Henrietta
story
Lacks. So
for our listeners who aren't familiar.
She's she's an African American woman whose cancer cells are like, they're the source of it's called the HeLa line. So this was the first immortalized cell line, and it's one of the most important cell lines in medical research. Like, it is still currently used in medical research. So, like, of course you ask, like, oh, well, how did they get that line, her cell line? Did they ask her politely? No, they did not ask her for her cell line. So she had cervical cancer, and she had a tumor biopsied for treatment at Hopkins. So, luckily we're doing better now, as well as I know. But at Hopkins, and this doctor, and I believe his name is George Otto Gay. I don't want to pronounce that wrong, but they saw that her cells were like could be used for research, and they used them without her permission. They still used them. They did not obtain her consent. She wasn't compensated. Her family wasn't compensated.
Right.
If you read the book, like, it's insane, like, how detailed they describe, like, everything she was going through and, like, the pain she was in. And, like, I can't help but think that a little bit of compensation, like any aspect of compensation, would have helped with her health care and everything like that. And they're still using the cell line. It's really integral to research. And no one asked for it.
Right. And so this is a woman, like you said, like, battling cancer, and her cells have changed the medical field as we know it.
Period. Like, I don't even know where it would be. Like, if we didn't have, like, her cells to study and like, see the effects of things. Right. And she's suffering, and she's not getting she's getting as much care as she can, and she wasn't compensated. And it's ridiculous.
And so this happened back in 1951, and still used today, decades later.
Yeah.
Changed the medical field. So they took a part of her body without asking.
Mm-hmm. Repeatedly.
Like,
and they were selling the cells for research and stuff like that. Like, it's insane.
And then no one's been compensated for it. And that's that's abhorrent, right? That's really, like, tragic. One of those tragic situations where clearly, like, there's some sort of malpractice here, and some gross, like, abuse of power as the medical professionals who participated in that.
And you can see why some people would just be like, well, the biggest way not to get in that situation is to not, it's just to avoid medical professionals, or like the Tuskegee study, which I think more people
familiar
about,
with this,
which was studying the progression of untreated syphilis. But then,
for among African American men.
African American men, and they were dealing primarily with sharecroppers, and even when there was a cure, and they said they were treating bad blood,
right?
But they were treating. They weren't treating anything. They were studying the progression of it, and even when there was a cure, like when penicillin became the known cure for it, they wouldn't give it to it. So they were interested in studying the progression from getting the disease till death. Like, we're not giving you the cure. You want to see how it is when you die as well.
Right, which is completely unethical for any sort of research that you do involving human subjects.
It's insane, because, like, the amount of stuff that I have to do to get a research study that includes a survey, like just asking people questions, trying to get it approved, it takes months. But, studies like this basically, change the face of research. Right. But it also increases the fear. Like, so I'm not going to say the stigma isn't unwarranted. Like, I'm not going to say it doesn't make any sense to have the fear, because automatically when I have a patient and I meet them in the waiting room for the first time and they see it's me and it's a Black patient, their chest, like, deflates. They're like, oh my God. And it's like, I kind of appreciate having that kind of buy-in where it's just like, okay, like, you're already a bit more comfortable with me than you may have been with my colleagues. So the fear is understandable. Right. But it's like, when it gets to a point where it's pathological, where you're not getting help when you need it, like, that's ridiculous. Because, just like we said before, being a minority, you already have more stressors. Period. We have more stressors. We see people less. Like, that's a terrible combination. Like, it's an awful combination to be like, I'm going to be stressed out more than my colleague,
Right.
and I'm less likely to go see someone for it.
Right.
And I think a lot of people think that mental health disorders and stress, like, that's just like, oh, it'll all calm down. But the way your body reacts to that, like you mentioned before, like the sympathetic nervous system and like blood pressure is a result of what you eat, but it's also a result of like how your body is reacting to stress. Like if you keep escalating and de-escalating, it's going to get harder to bring stuff down. Like your baseline is going to be higher. So that's an issue. Or you may have back pains, or you may get headaches. Like a lot of this stuff can be from diet and exercise and like just genetics, but a lot of this stuff is from stress. Yeah. Like stress and sleep are the biggest things that people need to focus on. Stress is a killer.
Yeah.
So I think people don't take it as seriously when they're just like, everyone has that same thing. They say diabetes, you take insulin, mental health, you go to therapy, but it could be like, oh, you got GI issues.
Right.
You may need therapy for that. Like it might not just be like going to the doctor and they're just like, we can't figure out what's wrong. It could be stress.
Right.
So,
I also think in general to, just to piggyback on something that you mentioned early on in your statement, and that's that, for people of color, and in particular like Black folks, knowing that this is our history, right, and that this, whether conscious or unconscious, again, like this is something that that our community has experienced and at times continue to experience. There have been more recent studies. I think since 2010, I'll say, to ballpark it, where medical students, I believe at Harvard, were looking at whether rates of their perception of the patient's pain.
Oh my God! I remember
yes, you're familiar with this, right?
And it was after 2010, actually.
It was.
I cited this.
I think it was
in one of my dissertations.
Yes.
Absurd. So talk more about this ridiculous.
Yeah. So maybe you're more familiar with it than I am, but as I recall, what they found is that the medical students at this prestigious school
and I think they actually asked some doctors as well. Like I got to double check, but I think they actually asked people who passed their boards as well. Yeah. And
we'll share this. We'll share this study.
We'll put in the
on our website.
The thing, like, we won't expect you to read the whole thing. Really, all you gotta read is the abstract.
There's just really
read that little bit at the top. Like,
right.
That'll give you all you need to know, unless you're trying to cite it, which I had to read everything.
But we'll sure to try to share this on some of our platforms, including Facebook, and as well as our website, www.theblackunconscious.com.
Yeah.
But essentially, what the studies found is that these doctors, predominantly white group of doctors, the research study found that these doctors were more likely to rate the Black patient's pain as lower than their white counterparts.
Yeah.
And some of them also held the belief that Black skin was tougher and more resilient and robust to pain.
Yeah, there was a certain part, I believe, in the study where they asked these questions that were not, they weren't found in research at all. Like they were just like, true or false or something like that. It might have been a Likert scale. That was just like Black people feel less pain, true or false. And then bunch of fools check true, they feel less pain. And it's just
right.
And you think that we've come so far, but other than it just being stupid about these people just being straight up fools, think about the implications that has. Think about the implications it has when you go to a doctor, they think you're not feeling that much pain. You saying you at a 9, you're like, oh, well, their 9 is a 5 for me, so I'm gonna just give them this little amount of medication. Like, it's just so dumb. In addition to the fact that one of my studies that I researched said that CVS is predominantly, not CVS's, but pharmacies, and predominantly Black neighborhoods are less likely to have the adequate amount of medication, like pain medication. Sure. Like it's a whole issue. So it's just like, another reason why, like, I get the stigma, like, these people, like, this is for real. Like, we feel less pain. Where did you get that from? Like, who told you that?
So there's even I hate the argument that that racism is like an education thing. Right. No. It's not. Like, racism at its core, right, is about, like, it's about dehumanization, and there's still so many ways in which Black bodies are not seen as completely human or equally human to that of the majority culture. And these studies actually speak to that. I mean, think about the Tuskegee study. That went on for 40 years.
After a cure for the thing that was going to kill them was found.
Right. After it was found.
Still didn't give it to them.
Right. And so that was years ago. But now this is a fairly recent study where these very, very intelligent, very highly educated people, soon to be doctors and perhaps some doctors included, are basically saying that Black folks don't feel as much pain because there is some sort of magical power within their skin.
Now the melanin magic is real. That's real. Like, we, have skin of the gods. Like, we're amazing. But like, we do still feel pain though. Like, it's not like
we're human.
We're human. It's just, and that's the thing. It does get down to what you said. You don't really see us as human, and I don't think the education has anything to do with it, because what was that? So many people we getting called the cops on, but like, what's the new one? The new one's Permit Patty, and she has some kind of education and she business. But what was the old one? The barbecue?
Barbecue Becky, I think it's
Barbecue
what it was
Becky.
Yes.
Yeah, and that whole thing, like, and they're looking like, I saw someone talk about it recently, like both of these women were educated and like they're using the cops as their own personal service. And some people don't realize that, that's basically threatening our lives. But some people are just like, well, you shouldn't be selling water then. Like, water, sorry. You shouldn't be selling water then.
Right.
That's on you. So no, and it's one of the reasons why there need to be more minority clinicians, because there's just some stuff that you're just not going to get. And then there's just some people who just won't, come in and see you as a clinician, because they have that fear that you won't understand things. Even when, like, that was something that was very important to me when I found my clinician. Like, I really wanted, I wanted a female, and I wanted a Black female. Like, that was something I had to look for in there.
Right.
It's just the stigma is concerning. The fear is concerning, but I think we are starting to break through it with things like this, like just with the podcast. And there are a lot of mental health podcasts, but just breaking through it was just bringing more light to the issue.
Well, and also speaking about some of the, part of why it's hard to address stigma and move forward. Although I agree with you, we've made so much progress. We talked about last episode very briefly about how mental health and even self-care has been more of a mainstream topic these days in our culture. But I think one of the things that's like hard about addressing and moving past like some of these things and having like some of the culture shift towards being more accepting towards mental health is that we don't. I still feel like it's not talked about enough. And like once we have to be able to name things and discuss them in order to heal from it. Mm-hmm. So I think it's important for us to be mindful of stories like Henrietta Lacks, to be mindful of the Tuskegee study, to be mindful of these young doctors to be and how they perceive us, because that helps us to understand what gets in the way for us in terms of seeing certain professionals.
Yeah, because once we know, we could combat it.
Once we know, then we can address it. Once we know, then we can search for certain things. Once we know, then like you can work with it once we're able to name it, but also not just name it, but also process it. I agree with you too on the idea that a therapist needs to be able to deal with all the parts of the identity that a patient brings into the room. Yeah. Right? Like and for some people of color, again, understandably so, because the evidence is stacked. This is not fairy tale. Like these things actually happen, right?
Peer-reviewed journals, which are very hard to get into.
That's right.
FYI, with a high impact factor. Just putting that out there. But no, like it's very real.
So you can see like you. With that said, it's very clear to see the ambivalence and the conflict that someone who needs help would have, like a Black person in that position, but also perhaps having personal experiences with clinicians of the majority culture or of another ethnic group, or just hearing stories of family members who've had bad experiences or past ancestors who've had a bad experience. You can see the conflict that sometimes that puts people in terms of wanting to seek help if there isn't someone they're comfortable with. So for some folks, right, there are plenty of black folks that see white therapists, or
Yeah, and they're comfortable with that. Like that's
or straight patients that see gay therapists,
Yeah.
right? There isn't there isn't a really serious recommendation for any sort of identity matching. What is important though is that we're able to work with someone that understands us.
Yeah, because you don't, it's like, this is a terrible, but it's like, okay, say you had a vet, right? You were taking your vet.
Oh boy.
Say you had a vet and like they didn't, no, I'm not going to use that one because I feel like that's going to get misconstrued. But I think it's just being important of like, making sure that they understood, they understand you, because, and also making sure you understand what's important to you. Don't use it as a cop-out. I do think some people use it as a cop-out, like, oh, they don't have any black clinicians, so I can't see them. Yeah, but you still have depression. So, you know, that's still something that you have to do. So to me, that was something important when I was looking for a clinician, and I was able to find that clinician, thankfully. But if I wasn't able to find someone that matched perfectly, then I would have just, adjusted and tried to find and just make sure that I'm comfortable with the person. Because at the end of the day, you are disclosing a lot of personal things. So you do want them to understand you.
Right.
I'm not going to act like a black person is not going to understand me more. But I mean, that doesn't mean that I'm just going to just sacrifice my mental health just because I can't find that person.
Right.
So you have to decide what's important to you and make sure you take it into context. Like it was a little difficult for me to find a black female clinician, but I found her. And this, of course, was before therapy for black girls, by the way. So this is before therapy for black girls. And there's also therapy for black men now as well. So, and
Therapy for Black Girls, of course, is a podcast.
Oh yeah, so Therapy for Black Girls, it's a podcast as well, but it's also a website. And it was started by
therapyforblackgirls.com.
Yeah, therapyforblackgirls.com. She also has a podcast. I believe it's Dr. Joy Brown. I don't want to get that wrong, but she said that she started it because she was watching Black Girl Magic one day, that BET show, and she just, she's a licensed clinical psychologist, and she was just like, I wish there was a directory for people to find black clinicians. So she made it. It's like, if I can't find it, I make it.
Yeah.
And then she also does a podcast every single week where she, breaks down certain things and stuff like that. So that's helpful. There's also Therapy for Black Men now, which I just found on Instagram. It's fairly new, but they're like revving up very quickly. And I think they also have a directory of clinicians as well. So that's very helpful. But yeah, like I think it's definitely getting broken down more. But I think people still have questions about like, so what do you do during therapy? Yeah,
so to that, so let's get into that, because I think that this is a part of stigma as well. Like I think, and I alluded to this in the beginning. When it comes to receiving,
I'm sorry.
Health,
I just want to correct this really quick. It's Dr. Joy Harden Bradford. I don't know where I got Brown from. I do not want to make that mistake. It's Dr. Joy Harden Bradford. I have no idea where I got Brown from, but I got Joy right.
And she runs the
she looks like Joy.
Therapy for Black Girls.
Yeah. So sorry, I don't want to cut you off, but I don't want no problem.
Well, no, that's important to note, because I think also like we want our listeners to know about other resources that are available, especially if you're looking for especially if you're like a black person looking for a clinician of color.
Yeah, but it is still therapyforblackgirls.com. So I got that right.
So I did want to say. Right. So what happens in therapy, right? Like, I think it's mysterious for a lot of people who have never been in therapy, who don't know too much about mental health. And I think that contributes to stigma as well. Just not knowing much about what it is. And, when it comes to working with someone that you're comfortable with, comfort isn't something that you get immediately.
No, it's not.
It's something that you have to work at. Like having a therapeutic relationship is different than any other relationship that you could possibly have. Actually telling the therapist how you feel about the therapist. For example, a black person meeting with a white therapist might want to talk about, of course, some of the racially charged experiences that they've had in life. Because that's right, naturally, because that's the salient part of your psyche, your personhood, your well-being. It's a part of who you are, and that shouldn't be experienced as a burden for anyone, that you need to talk about a particular aspect of yourself. So when speaking with a white therapist, I think it's important to be able to bring up race, or to even maybe take the gamble or the risk of bringing up race, and to see how it's being received, to talk to the therapist about your perceived reluctance with opening up to them because they're because you perceive that they may not be as familiar with some of the experiences that people who look more like you are.
Yeah, because even that can be therapeutic. Like you said before, it's all about comfort. So yeah, like you may feel better if the person looks exactly like you, but you still need help. So you find a clinician, and then you can find that like, oh, I am still comfortable talking to this person. Like this person still receives everything well.
Right.
So.
And if they, well, that's the test, right? Like if they handle it well, like if they can handle it well, if they can receive you discussing your discomfort, your race or culturally based discomfort, if they can empathize with some of the frustration you have not being able to find a therapist of color, all of those things, like anything that you feel or think or perceive, if you can bring that up with your therapist, whether it be about the therapist or about yourself, like those are the kind of conversations that that have the potential to be incredibly healing. But I think sometimes it does take us taking the risk of being able to bring those things up. Now, if it shows that over time, let's say the first couple of times around, like there's not it doesn't feel like the therapist is really going there with you. It's clear that your understanding about racial identity and race and power dynamics within this country are far more advanced than that of the therapist, and you're not in the mood to educate or take on anyone else's burdens because you're here to get help, because that does happen. And when that happens, then there's another conversation about the therapist not doing a very good job. And you talking to the therapist about your feelings about what they are or are not doing well. And then when it doesn't get resolved, if that doesn't move things in a better direction, if there's no traction there, then it may be time for you to find someone that you feel is better equipped to deal with the kind of things that you want to bring up.
Or they can help you find it. Like they should. Yes. The biggest thing is knowing being mindful of where you think you're in the deep end, and you can ask them like, hey, I'm just having an issue with this, and I feel like we're at a standstill. So. I'm going to look for people. Is this some place where you can help me, where you think you can find referrals? Because there are clinicians that I know that are way better at things like loss of control eating or eating disorders or like military trauma and stuff like that. And because I know how good they are at it, I know how I am not as good at it. So I would refer them to that person. Right. Like I'm very well versed in the fact that like when you were talking about couples therapy, unfortunately have had to do, not unfortunately, but like sometimes some of the family therapy leads into couples therapy, but we always refer them because that's not where my expertise is. It's like one aspect of psychology is not the same as every aspect of psychology. Right. I think everyone needs to understand that. Most times people have a page on ZocDoc or something like that where they talk about like their expertise, or they have a website.
Or Psychology Today,
for example. Psychology Today,
it's a great resource, by the way, psychologytoday.com.
Yeah, or because you have a website and you talk about your expertise as well. Yes. Like look at that, because like if what you're concerned with isn't on their expertise, like they didn't put it down for a reason. Mm-hmm. But you can always call them and ask them for a referral. Like you can ask people for a referral. Yeah. You're not doing anything wrong with that. So I think that would help too. Like just things like this, listening to things like this to help combat the stigma of like what therapy is, right? What you do, because all sessions are different. I know with like just specifically with our type of sessions, you come in, we do like an intake where we're talking about like what brings you in today. It's a textbook, like what brings you in today, and then we have goals and we're trying to achieve certain goals, and we do them in different ways, right. Whether it's with the child, whether it's with the parent, individual therapy, family or group and stuff like that. And some sessions are different like than that.
Yes. I think that's a really good point. Like match and fit are really are a really big part of like finding a therapist that works for you, and I mean that in terms of like style, like how therapy is done, because therapy is done many different ways. Like for some clinicians, as Raquel mentioned, there are pretty there are goals that maybe come up with that the clinician and the patient come up with together, or there's some forms of therapy where there is homework and worksheets and so forth. The style of therapy that I particularly offer, that I may have shared before, is psychodynamic, and to me, and you'll hear my bias comes out as I'm explaining it, but it's this very rich form of therapy where there's this open kind of exploration about who you are. And the ultimate goal is really to increase your understanding of yourself. And with that increased knowledge and understanding, you can make more informed decisions, make more, and just know more about who you are. And so my job as a clinician is to try to understand you to the best way that I possibly can. And and oftentimes that's what, that level of understanding, as mystical as it sounds, really helps people to heal. The more that you can like learn about like who you are, what your experiences are, things that are again like outside of what you already know about what you're going through, the more information you have at your disposal to come up with solutions or negotiate new ways to get your needs met.
Yeah.
So all of that to say, to just demystify therapy a little bit. I think one thing that we want to do real quickly too is also to kind of outline like the types of mental health clinicians there are.
Yeah, because I get that a lot too. So like there's psychologists, there's psychiatrists, there's counselor,
social worker,
licensed clinical social worker.
Yep.
Also, like therapists. So a psychologist, a mental health clinician, a psychologist, a licensed counselor, and I think there's some other types can all be called a therapist. Yeah. Like that therapist is just a term for someone who is given mental health care. Like I am not a psychologist yet, but I am a therapist.
Yes.
So it's those terms are different.
Someone who practices psychotherapy.
Yeah, thank you. Words. Someone who practices psychotherapy. Therapist, right? But there's difference in the levels of education and the things that they do. Like, for example, I have recommended someone to go see a psychologist, and they were like, they don't want to take meds. Psychologists do not prescribe medication.
That is correct.
So it's just like, that's one thing of educating. Like, psychologists do not prescribe medication. Psychiatrists do.
Unless you're in, New Mexico or New Orleans. I think
there's a couple of places.
There's the only two states where psychologists have prescription privileges. Yeah.
So it's growing, but like primarily psychiatrists are the ones who, or PCPs, your primary care physician. I would go to a psychiatrist though.
If
you're getting mental health medication.
Yeah.
But prescribe medication, and there are some psychiatrists who do also conduct therapy as well, but psychiatrists honestly get a lot of the burden of when it comes to prescribing medication, so a lot of them don't really get time to do therapy.
That's
like
correct.
it's they just don't get the opportunity to, whereas psychologists, that's what we do.
Right. Well, the large majority of psychiatrists are also not trained in therapy. There are some that do additional training during the course of their residency or just completely post-grad. But
and every psychiatrist I've ever met had no interest in therapy. So I like, for real, like, it was like,
but I do know some.
Therapy,
I know a good number of psychiatrists that do therapy. But yes, the large majority don't. That's correct.
Yeah. So and you can just check, because you can be meeting with a psychiatrist who does therapy as well. And it's like, cool. Like, we can talk about medication. I can also do therapy. But you have to ask.
Yes.
Because no matter what, bottom line, psychologists the majority of psychologists do not prescribe medication.
Yes.
And the sessions are different. Like I know, a lot of my patients have a psychiatrist as well as they see me. So they're getting medication and they see me for the actual therapeutic process. But don't think just because you're going, like, you don't want to get medication that you can't really see a psychologist or see a licensed clinical social worker or see a counselor.
Right.
To get help with things. I think that's always a concern where, that's a stigma too. Like, I don't want to take medication.
Yeah. So
which is kind of like, why?
Right. Well, let's get into that. Before we do though, I just want to say also, like, there's one other distinction I'll make about psychologists is that's different from all of the other mental health positions, is that psychologists are the only ones. Usually, again, like these lines, of course, they're not rock solid. They do blur depending on what state and depending on yada, yada, yada. But usually psychologists are the only ones that do psychological assessment.
Yeah.
So when it comes to diagnosing ADHD, learning disorders, Oftentimes dementia, those tests are done by neurological psychologists or neuropsychologists.
Yeah.
Intellectual assessment, personality and emotional functioning assessment.
Yeah, trauma, all that.
Autism assessment. Like those kind of assessments are almost always done by a trained clinical psychologist.
Because the training is way different.
Yes, it very much is.
That's another thing that's different between all of these clinicians. Like the training is very different.
So Raquel and I are very specifically trained in doing psychotherapy as well as doing psychological assessment. So let's go on to what you had just mentioned a moment ago. So the stigma,
why no drugs?
Yes. why no medication? Yes, I think this is a big. I agree with you. I think this is a big issue as well. People have a lot of hang-ups about taking medication.
There's so much stigma with medication. Yes. And if you don't need it, fine. But some people do. And there's always an issue with that. I can understand that. But I sometimes...
For me, let me say, when the number of times I've thought to encourage patients to to consult with a psychiatrist. The counseling center, one of the counseling centers in the area that I work at, and we're located in DC. If we haven't made that abundantly clear yet, but
he's in DC. I'm not in DC.
Yeah, that's right.
I am not in DC.
You want to tell everyone where you're at?
I mean, I'm outside of Baltimore. I'm in Maryland, but if I said the city, you would know. So it's
it's true.
I'm 30 minutes outside of Baltimore. It takes me 30 minutes to get to work.
DMV.
Yeah, DMV. Yes.
Okay, there we go.
We're both in the DMV.
Something we can get on board with. There you go. Right. When I end up referring people to consult with some of the my colleagues, psychiatrists in one of my offices, they often one of the replies that I get is that I don't want to be on medication my whole life. That's the concern, right? I don't want to get hooked. I don't want to have to depend on this my entire life. And sometimes, and I get that. And it is true to an extent. Yes, when you start taking some of these medications, yes, your body takes time to get used to them. It also takes time to get off of them. But people do both.
Yeah.
The body adjusts. You get used to them, and you also when you're weaning off, people have success with doing that. So I often think this concern about being on medication forever is kind of putting the cart before the horse. Also, if it's bad enough, right? If it's bad enough and it's really kind of ruining your life, what you're dealing with, and this medication is helping. I think for some people, for the smaller number of people that do have to take it for an indefinite amount of time, does it not become worth it if it's helping?
Yeah. And I think that's one thing. Also, people hear about bad experiences that somebody may have had on medication, like Ray from down the block or something, which has nothing to do with you because, no matter what meds, any kind of medication is interacts with our biology and stuff like that, right? So-and-so may have had a bad reaction to something. You don't know how much they took. You don't know their dosage. They don't know, by the way. And you're going to interact differently. Also, no, I think mental, psych meds are way different than other meds. You take a painkiller, your painkiller is going to work, right?
Yes.
That's the thing. But with psych meds, you got to see what works out right. The dosage may be different. The timing of it may be different. You do really have to want to work with the person to see what works out. Something may not work for you. Right. And then we try something else. There are multiple, there are a bunch of different kind of medications. They interact differently. Yes. But anything, the biggest thing with mental health, I think, is that it does take work. So you do have to want to, I figure out what's going on with the medication and don't just knock it out the first time. But I just hear that's just the first thing I said. I don't want meds. Right. Well, if I think you need to consult with someone, you need to consult with someone. I'm not just having you come up and being oh, you know what? I got stock in this company. I want you to try this med. No. If I told you need to see a psychiatrist, you need to see a psychiatrist. I'm not saying don't stop therapy. I'm not saying that you're
right.
the word that I don't even use like that anymore, as I'm talking about me, like crazy or anything like that. I'm saying something else could help you. Like I'm seeing something that can help you more than this, something that can make it slightly easier for you. Right. And then if you decide you don't want to be on the medication anymore, tell your clinician and they'll tell you how to get off of the medication. Right. That's it. Like I'm not going to like hold you down and put you on the medication. And then if you tell me you don't want to be on it, fine. Like, you may be making stuff more difficult for yourself, but I mean, we'll work through it. There's nothing. I'm not forcing you to take the medication. It's always a choice. But if I recommend a medication, I never take any kind of. I don't take that lightly.
I mean, there are often times when people go to a psychiatrist just to learn more about medication.
Yeah, you can. That's
and
another
different
thing.
Kinds.
You can talk
Weigh your
to
options.
Clinicians. Like you can. We have like when I worked they always have like you can call us and be like, hey, so just had questions about this or something like that. Like someone will get back to you. And as someone who worked in a community mental health clinic, we got back to everyone. Okay. Yeah. So like, it's not like we had like a ridiculous amount of staff, but like we got back to everyone. We have had people calling me like, I just want to know what the session will be like.
Yeah.
I just want to know how.
Just out of curiosity.
Just out of curiosity. Or like, how much is this going to cost me? Like, there's nothing wrong with calling and asking questions. Yeah. You'll get somebody.
And I'll also say there's nothing wrong with having an appointment with a psychiatrist just to ask questions. Just because you agree to go to an appointment doesn't mean...
Just talk about it. Like, there's nothing wrong with talking about it. I understand no one wants to be on medication, but it's just very ironic because everyone likes to self-medicate with stuff all the time. Mm-hmm. Whether it's like... oh, I just need a glass of wine today or something like that, which I'm not saying nothing against because I do like wine. Or like everybody smoking weed or taking edibles. It's very prevalent. Some people do it for different reasons. Some people are doing it just because like, oh, I need to take the edge off today. What if like you had a technique, like, I don't know, a breathing technique or something that would take the edge off instead of having to take that edible today? Like, I'm not negating, I'm sure some people like their stuff, but it's just... I think a lot of people will say no to medication, but then they don't really take into account how they self-medicate. And even food. Right. People self-medicate with food, too. Because when I'm having a stressful day, I don't want a salad. I want a pizza. Right. Okay? So it's just like, like there are other ways that you're handling your stress, and we're just trying to give you more effective ways. But I've never taken like a referral to a psychiatrist lately at all, because one, I know I'm gonna have to have this conversation about you not wanting to take meds. Mm-hmm. So if I'm gonna have to put myself through this conversation that I do not feel like having, there has to be a reason. Right. Like, especially if you're feeling anxious, and I feel like we're working through the techniques, but sometimes just helping you out a little bit more to like get you in the door, decreasing that stress a little bit more. Oh, and nicotine. There's also self-medication with nicotine too.
I agree.
So,
absolutely.
Yeah, it's just...
Well, they also say, like, so they're so interesting. They say, and by they I mean just some of the people right here, some of the research that I've read suggests that some of the benefits from actually smoking a cigarette are from the deep, relaxing breaths that you take while inhaling.
Yeah, so take those breaths without cancer-causing chemicals. Like, not biased at all. I hate nicotine, though. So, just put it down, guys. I actually am still surprised in 2018 people still smoke cigarettes, dude. Surprised, like, this is crazy.
Well, Raquel, just a moment ago, you used the C word, crazy.
Oh yeah.
Well, you used it just now too, but minutes ago you used the C word, and I think that that's one of the most obvious. I mean, we're saying crazy because there's another C word. We don't use that one like as a people. Don't even know what it is.
Yeah, that's so funny. No, I don't use it with people. I use it more with me. Like I always say, I'm tripping and crazy. When was the other time I used it?
Well, you were talking about I think you were saying like you're not crazy, but I'm not exactly sure. But
I was talking about me, right?
Yes, you were talking about.
I come so crazy all the time.
I think you were.
Because I come so crazy all the time, but not like I don't say it with patients because like I don't use that word, but I say it with myself all the time because. Yeah. I mean, I know I'm. I mean. Everyone has their moments. But no, I don't use it with patients. Well, I try not to use it that much.
I think everyone has their own little their own personal flavor of madness that is their life, right? Everyone has that. But I'm
in a PhD program. How it don't get no more illogical than that.
But I'm also
forever.
But I'm also referring to using that word crazy as it relates to stigma, right? Yeah. Like, and how like people often think like when if you're struggling with some sort of like mental health issue, whether you're feeling really down or just not feeling like yourself, or can't get certain thoughts out of your head, like feel like they're losing their mind and losing touch and like going crazy just because they're struggling a little bit and just because something feels off. And that's not necessarily true. I mean, just because you're feeling off, or just because you're feeling down, just because you're feeling depressed or anxiety, doesn't mean that you're losing touch with reality. What I do think, though, is that for when we talk about shame, stigma, for a lot of people, shame is what comes up. We feel ashamed for dealing with certain things, for struggling, and shame is one of the most powerful emotions that we have.
It's kind of like feeling weak, like, oh man, I shouldn't be.
Right.
I feel bad for feeling like I can't handle everything.
And it prevents us from doing any sort of work with the issues that we deal with, because shame says we shouldn't be feeling it, we shouldn't be going through this. This somehow should not be happening, and I'm wrong. There's something deeply wrong with me that it is happening, and I need to cover it up somehow.
Which isn't the case. Like, everyone's dealing with stuff.
And I do think for Black folks in particular, right? For so long, like our experience has been like we've had to be strong. Like we've had to be. I think there are times in our history where we literally could not acknowledge the full. We couldn't deal with the full like impact of how we've been dehumanized throughout history while it was happening, because we're just trying to survive and get through the next day.
Yeah.
Right.
Like, I'm just trying to live, like, and it's still present today. Like, I'm just trying to if I get stopped by the cops, survive.
Right.
You know.
Right.
Like, go through it. I mean, every day is a thing. Go through the day without having someone ask to touch my hair. Like, just everything is a thing. Right.
Well, I also think that like similar, right? Like similar to that, like most Black folks have like heard the saying that in order to be successful, we have to be twice as good, right? The margin of error is so much slimmer for us.
Yeah, and it's also true though.
It's also true.
Like, some sayings aren't true, but that's true.
But it is also true.
That's
it's
very
actually
true.
It's like
we represent our entire race. Like, it must be amazing to do like one thing wrong, and you only represent yourself instead of representing every single person in the world.
All humans struggle, right? We've talked about life being difficult for everyone. Like, everyone struggles, but when black folks make a mistake or they struggle, it echoes so much louder.
Yeah.
In comparison to our white counterparts, and it
even like, think about the presidents. Like, come on, like.
Right.
If President Barack Obama, who's the only one I recognize, had half of these issues, are you kidding me?
Well,
are you serious? Like, it's true.
I agree. Obviously, right? So, it's quite obvious, right? That that's a part of like white privilege, right? That that you can have the kind of demeanor and the kind of personality that 45 has, and still hold your position in office. But we know that Obama was criticized for wearing a beige suit. He was criticized for inviting Common to the White House. He was criticized for so many different things.
It's crazy because he looks fly in every suit he wears, and Common is amazing. So how dare you?
I mean, black coaches in both the NFL and the NBA are constantly being fired before giving an adequate chance to actually do what they do. Like, whereas their white colleagues get chances to fail over and over and over again. So we don't have the chance. We often feel, accurately so, that we don't have the leeway to fail or to struggle.
Yeah.
And so it cultivates this sense of shame when we do struggle. God forbid we show our humanity and feel like things are difficult for us, so we actually acknowledge it. It often feels like we shouldn't be doing that. We often feel ashamed for struggling in ways that are completely normal and human to struggle. And
I think that's like the theme for the episode. Like, there's we get it. Like, we understand.
Yeah.
your reasons are valid.
Right.
However, they are still hurting you.
Yes.
So like like, because that's what honestly, every single point we've made is like, yep, that's rooted in this. That makes sense. Yep, that's rooted in this. It makes sense. But don't you still need help though? Like, so.
Right. So we endure more obstacles. Yes, that's true, and we expect to. And yes, we feel the shame both internally, right, for ourselves, like we're struggling, but also we feel it like externally, right, from the pressures that we need to be twice as good, et cetera, et cetera. So all that to say, I think there's a sentiment that we can't afford to fail. I don't think we can afford to dwell on shame.
Like, no, because if you think about it in the same way, we can't afford to fail, right? So like, if you think of it as like not taking care of yourself is a way of failing, let's think of it that way. So right. Like, you know what? Can't afford to fail. Not taking care of myself is failing. Gotta go to therapy, man. Because like right, that, right. Let's just change the dialogue. Because everyone has so many people dependent on them and everything like that. Think about how much your stress, like your mental health, like your anxiety or depression or personality disorder, or there are so many different disorders like that take you out because you're not handling them appropriately. Mm-hmm. Like
your wellness takes management.
Your wellness takes. I like that. Your wellness takes management. Okay, yeah. So your wellness takes management. So just think of it that way. Like it's not like you're failing others, but you're failing yourself.
Yeah.
By not taking care of yourself. So if we understand this is stuff that. This comes up with also every time I have a new patient. Like, I work with kids, so like the parents like are coming most of the time because the teacher referred them, and they just in their face about it. But like the parents are always just like, she needs something. I do not think there's a point to being here, and I'm like, cool, let's workshop that. Let's talk about that, because like, there's clearly a point to them being here, and then the more we work together, the more they realize like, oh yeah, this did help. But it's because they thought that they were just gonna be sitting on the couch, like just. She's just gonna blame me because I'm the mom, and and that's just not the case. Like, there's so many different things you do in therapy. Like, we talk about mindfulness. That's something that needs to be taught. Like, we can do breathing techniques. Like, and I don't have sessions with patients forever. Some of them are like, oh yeah, we're here for 4 to 6 weeks. So we do booster sessions. So I see you every like couple of months and stuff like that. Or we're doing like problem solving. Or we're doing. I call it it's called cognitive restructuring, but it's really just teaching you to work around your thinking traps, like the things that make you feel awful. There's a post of it on our Instagram page, but like catastrophizing and stuff like that, like learning to analyze how you think and fix it, so it's better.
The basic idea that your thoughts lead to certain feelings, which lead to certain behaviors.
Yeah, yes. So that aspect of it, and it can also be another side of it where you are delving into the depths of your unconscious, and you're taking the time to do that. But there's so many different types forms, of techniques and therapy that you have to figure out what works for you. Right. Because why not? Like, aren't you worth it? Like, I'm worth it. So like, don't you want to just like, it's just we get this like one life, and everyone. You should be here more than just to work and pay bills. Like, don't you want to be more like self-actualized? We all want like stronger relationships. You want friends, not acquaintances. You want like a husband or a wife and not like 50 different girlfriends. Don't you want to have that kind of relationship with yourself? Like, don't you want to know yourself better than just because stuff will just pop up, man, and you will not know where it came from.
I absolutely
it came from your unconscious. Like, it's just like I just think you need to be more mindful for things, and I think that there's nothing wrong with seeing somebody about it.
So clearly we're really strong advocates for therapy.
We believe in the powerful therapy. My whole life to this. Right. Oh, but I will say another thing that gets in the way: money. I get this.
Yes, okay. That is true.
Primarily, I work at community mental health clinics. I've chosen community mental health clinics most of the time because that's where. I've always wanted to work with minorities, and that's where most of my patients look like me, period. So a lot of places have sliding scales. Community mental health clinics have sliding scales. And then also, like, if you have, I can never remember if it's like Medicare or Medicaid, which one is for. But like some of them, you will not have to pay, but I don't know exactly. But the way to find that out is to ask, like to call. Like, they have no problem like looking up your insurance and being like, oh, this is how much you're going to pay. Or like, calling your insurance if you have it and seeing what it is. So I get that income is something that will take you out from it and stuff like that. But like, I think my sessions cost like $25 a session, and like that's not. That's like what, like 4 Chipotle things? What's Chipotle? $8? Like, if you can really just think of it that way. It's just like, like, just don't eat out like 5 times that week, or maybe just drink water instead of stuff. Like there's a way to fit it in most of the time, but there's also so many people who are open to sliding scales or free services.
Yes,
like just ask them.
I think
like, nothing beats a fail but a try.
I think that's a key word to remember is sliding scale. If you do have reduced income or like making ends meet and trying like if that's a challenge for you, talking to therapists about their availability for to work with someone on a sliding scale basis, which means they'll adjust their rate to better suit you. So those kind of things are really important. I think also community mental health clinics are very useful. Obviously, they fill a much needed gap. There are often training clinics associated with major universities in your area. So where there are students who are closely watched by licensed clinicians. They're in their program becoming psychologists or counselors or therapists in their own right, but have to get their clinical hours by working with people. And those clinics often offer either free or very low fee services as well.
And they are being supervised. Like Justin, you're a supervisor.
I am.
So it's not just like, oh, I'm gonna just try this out on you. No, like everything.
Yeah, right. Everything's quite closely
we're
watched,
working under our supervisor's license, which are licensed clinical psychologists. So they are very much watching what we do, because if we mess up, that's on them. So it's not like we're just write this in a book and I'm gonna try this out. Nope, they're checking in. A lot of times, they're making sure everything is right. Like, there's nothing wrong with going to a university clinic. I mean, because that's how we all learn. Like, that's how we get our experience.
Absolutely. So just to kind of wrap this up and summarize some of the things that we've addressed here regarding stigma. The number one thing that I think often affects our community is our history, right? Our history, both our historical and contemporary incidences of negative treatment.
Because it's still happening. It's
still happening, right? Yeah. There's that recent study with medical professionals that were had this misperception about black skin and pain levels, right?
Yeah, so it's like, what did Jesse Owens say? Just because we're magical doesn't mean we're not real or something.
Yes, right.
Something like that. Like, yes, we are amazing. We get it.
And so,
like, we're human.
Right, exactly. We're human, right. And humans struggle because that's what life is. Life brings those at times. So, yes, there is evidence. There is reason for why like we tend to distrust the medical profession and mental health profession as well. I mean, even in its genesis, psychology was misused in ways that it shouldn't have been.
Yeah, and that's we have a whole nother episode.
Possibly, right.
So much of it.
So, but with that though, we talked about how it's so important to develop an actual authentic relationship with a therapist, whatever race, creed, color, they are, gender they are. If you can talk to them about the things that trouble you, even if their stimulus value, their personhood, right? Their whether it be their whiteness, their gender, their whatever it be, is something
vibe,
that
like certain personality styles just not gonna work with yours.
Sure. If you can talk about those things with your therapist about him or her, or them, then and see where it goes from there. Therapists are trained or supposed to be trained to be able to have those kind of in-depth conversations
and adjust
and process those things with you to understand where that's coming from, whether it's you, whether it's them, whether it's both. It often is both. And so, depending on what it is, if you have an out-and-out racist therapist, well, that's probably not you.
Yeah, get rid of that fool.
That probably has nothing to do with you. If you have an out-and-out homophobic therapist, it probably has nothing to do with you.
And try to also, follow up with, all of us have licensing boards, by the way. So, anything that's unethical, follow up on that.
Yeah, right. But if it can't be resolved, right, those may be the steps you need to take or work towards, finding a new therapist. We talked
everyone
about
has their own style.
Right.
I think everything is simple. For example, the same way I talk to everyone is the same way I talk. I don't have a therapeutic tone. Justin does, but Like, it's like real, like, yeah, so let's, but I don't. Like, that's how I talk to everybody. Like, so, you know, that may work for you. It may not. Like, either way, like, you know how you don't vibe with certain personalities. The person may be well trained and you may get what they're saying, but you just don't vibe with them. You can tell them and see if they'll adjust. If they don't, just ask to be referred, because they're still people. So it's their style. Like, it can be something about like race, gender, like, but it can also just be their style. Like, it's just this is just something that doesn't work for me.
We also talked about medication management and some of the common issues that people have with going that particular route. Mm-hmm. And we talked about the importance of like that trial and error period where you need to take time to really figure out whether a particular medication is going to work for you.
Yeah, most medication, it's not going to work in like a day, and it's not going to like work in like a week. So
it takes months for a lot of them.
So don't say
especially
like,
the antidepressant medications.
And I think people are so used to like instant gratification with like other substances that it just knocks back in, but that's not how this goes.
Yes.
So
it takes time.
It takes time. So just be willing, like, nothing, you know, just, it's working on yourself. So nothing works but work. But ask. I think that was another thing. Like, just ask. Like, there's nothing wrong with asking more questions.
We demystified some of what therapy is like, noting that it's, you know, there are different types of therapy, different styles. We also talked about the different types of therapists and different vocations within the mental health field. And lastly, we shared with you all a little bit about just shame and how shame can get in the way, how shame is manifested for us many times because the margin of error is often lower for us. Mm-hmm. We've had to be so strong for so long, but also that doesn't mean that we're not human too, and that's something we've been saying over and over. And
then lastly, like, how do we combat this? Like, so educating yourself is the biggest thing. Like, you could educate yourself through reading articles. You can. Kofi Cerebro just came out with this documentary.
Yes,
WTF is mental health. So you can look
that one more time.
Kofi Cerebro.
Yeah.
I said it right.
No. I wasn't saying the name.
I was like, I Googled how to say this man's name multiple times.
No. The title. Say the title.
Oh, it says WTF is mental health.
Yes.
I don't know if he actually says WTF, but it says, I don't know if he says that.
Perhaps we can provide a link to that as well.
Yeah. So we can put that in our description thing. Also podcasts, like I listen to a bunch of podcasts. There's a lot of podcasts that talk about their experience. I know one that I listen to a bunch, but the one I listen to look at like the male perspective, they talk specifically about male like toxic masculinity is like Let's Talk Bruh. And then Between Sessions is another one. It's run I think they always refer to themselves as Two Brown Girls, but they run the Melanin Mental Health, and they all have IG pages too as well. There's Therapy for Black Girls. Also, this podcast is also great. Just FYI, I'm not biased as well. But you know, so if you don't feel like reading an article, maybe just like listen to a podcast or like watch a video. But I mean, that's one of the main goals why we wanted to do this was to help educate, and then talking to people about it.
Talking to the right people.
Oh yeah, you're
right. Finding the right people, because not everyone is going to be receptive. Not everyone is going to be accepting of the things that you have to share about your own mental health, obviously, but also just about struggling in general and what it's like to go through something that's uncomfortable. What it's like to go through the valleys in life and to really struggle. And so some people, you know, there's some friends that are definitely going to give you advice and not really listen to you. There are other people that will provide you the emotional support that you need.
That's why you need therapy as well. Like I think a lot of times it's been compared like, oh, I got a bunch of friends. I got a bunch of friends too, and I still got a psychologist. Because it's not the same. No matter what, my friends are biased because they love me as a person. So they're like, oh, girl, no, that wasn't your. Actually, no, my friends tell me when stuff is my fault all the time. But like it is good listening to someone who's also been trained in it. Don't think about it as like just talking to someone. We've dedicated like so many of our young years, they're gone, to education and being in school. Like I'm still in school. Like this is something that we've studied. It's not like a whole pop psychology aspect. We have like read stuff and taken tests and like defended dissertations and thesis. Like this is something that we've trained in. So it's not as simple as talking to someone about it, because if it was, everyone would do it, and everyone doesn't. Like I'm not even done yet. So like there's that whole aspect. So yeah, I think that's a good wrap up.
I think so.
Thank y'all for tuning in. So once again, where to find us. So we have an Instagram page, which is The Black Unconscious. We have a Facebook page, which is The Black Unconscious. I mean, it's facebook.com/The Black Unconscious, but Facebook's been around for a while. You know how to work it. And then Instagram is The Black Unconscious. We have a Twitter that we're working on doing more with, but there's not that much on it now. But it's BLK Unconscious. And
then we have a website.
Yeah,
also,
and we have a website.
TheBlackUnconscious.com.
Yes, there's a theme there. So, The Black Unconscious. So, I know there's a parentheses in our logo, but there isn't in any of the screen names or anything like that because that is not allowed. That special character.
Right. So,
yeah.
So thank you so much for listening. We look forward to having you all back next episode.
Oh, wait, I forgot. I'm sorry. We also want to have a segment, like not parts of the segments, where we're answering questions and stuff like that. So on our website, there is a tab that says Ask Us.
Yes.
That's connected to our email. But you can also email us at theblackunconscious@gmail.com.
Yes.
Like, we don't want to be just like talking at y'all the whole time. I have no problem talking for a ridiculous amount of time. But answering questions would also be helpful too. So send them out.
With that, we're out.
Thank
you guys take care.